Hello, my name is Marina, and today I'm gonna be your nurse. Today we're gonna be performing the head, face, and neck examination, and then we're gonna move to the lungs and thorax. Okay. Okay. So I'm gonna start my assessment by inspecting the first part of the exam, which is the head. So I'm gonna inspect the head for symmetry, for proportion. I'm gonna inspect the hair for evenness. It shouldn't be uneven patches of baldness. Inspect for dandruff or any lice. Shouldn't be any. And then I'm gonna use my hands. I'm gonna palpate his head. I'm looking for any lumps, any pain, any tenderness. Do you feel any pain or any tenderness? Okay. Okay, so this is the head. Now we're gonna move down to the face. So I'm gonna inspect his face first. I'm gonna inspect his both sides of the face. Make sure that both sides are symmetrical. Make sure that there's no drooping of one side. Make sure there's no involuntary movements. Make sure that the face is not blue, it's not cyanotic. Look for color changes. Look for lesions, any sores, any rashes. Nothing. Now I'm gonna use my hand to palpate his face. I'm gonna touch your face. So first I'm gonna palpate his sinus. So the maxillary sinus here. I'm gonna apply pressure to this area. It should be discomfortable, but it shouldn't be painful or tender. So if you feel any pain or tenderness, tell me, okay? So first the maxillary sinus. Shouldn't be any masses or any hard bumps or anything like that. Do you feel any pain or tenderness? I'm gonna do the same for the frontal sinus here. Do you feel any tenderness? Now I'm gonna move to his temporal mandibular joints. So I'm gonna place my both hands here and ask Abanob to open and close his mouth. So the joint, I should feel the joint when he open and close his mouth get hard again. So it should be symmetrical in both sides. There shouldn't be any clacking sounds or any grinding sounds or anything like this. This is abnormal. Okay, so yours don't have this. So now I'm gonna move to his mouth. So first I'm gonna start by inspecting his mouth, inspecting the lips. The lips should be pink or pinkish. Of course, it varies if from dark skin to lighter skin and all of that. So it shouldn't be dusky or dry. It should be a little bit moist. He shouldn't be drooling, but it should be a little moist. It should be pink. Any blueness can indicate cyanosis, which means that his O2 saturation is low, like his oxygenation is low. So he looks fine. I'm gonna ask him to open his mouth for me, and I'm gonna look at the edges of his lips for any sores, any rashes, all of that. Now I'm gonna look inside his mouth. I'm gonna look at his teeth. Make sure that there is no lesions also in the tongue. Make sure that the tongue is moist, shouldn't be dry, shouldn't be any cracks in the whole mouth, lips or inside the mouth. Look at his teeth, any tooth decay, anything. Look inside at his hard palate. Make sure that it's there. Can you lift your tongue for me? Lift your tongue up. Make sure that underneath the tongue he doesn't have any lesions or any sores or anything like that. Okay. Now I'm gonna be putting my hand, putting my fingers inside his, palpating his mouth from the inside. So I'm gonna change these gloves. I'm gonna wear another glove. Okay, so now we're gonna start palpating the inside of his mouth. Can you open your mouth for me? So now I'm gonna put my finger, I'm gonna put my thumbs inside the cheeks. I'm gonna check his parotoid ducts for any tenderness, any lumps, any pain. So I'm gonna put my hand inside your mouth. Tell me if you feel any pain. Okay, keep your mouth open for me. You have any pain, any tenderness? Okay, and I don't feel any masses. Now I'm gonna put my finger underneath his tongue. I'm gonna check his sublingual ducts. Do you have any pain, any tenderness? Okay, now I'm gonna ask you to stick your tongue out for me and say ah.
Ah.
So I can see the inside of his soft palate. I can see his uvula, and when he says ah, it should go up. It should be midline, and it should be symmetrical to both sides. Say ah again.
Ah.
I don't have tongue depressor, so I'm gonna ask Abanob to say ah again, but this time say it for a long time, please.
Ah.
Okay. So I'm doing this to see his tonsils, because without the tongue depressor I can't really see his tonsil unless his tongue goes down. So when he does that, I can visualize the tonsils. So they look like they're not inflamed. The tonsils should not be inflamed. There should be no stones, no redness, nothing like that. Okay. So now I'm gonna move this. The mouth is done. I'm gonna move to assessment of his lymph nodes. So I'm gonna start the assessment with palpating his periocular lymph nodes, which is in front of the ear. So I'm gonna use the bats of my fingers in circular motion, and I'm gonna palpate for any masses, any hard lumps, any pain. Do you have any pain? Now I'm gonna move to the posterior auricular lymph nodes. Do you have any pain, any tenderness? And I don't feel any masses. Now I'm gonna move to the tonsillar lymph nodes. Do you have any pain, any tenderness? And I don't feel any masses, which is good. And then the submandibular lymph nodes. Any pain, any tenderness? Okay. And then the submental, right underneath his chin. Do you have any pain? Okay. Now I'm gonna palpate for the superficial clavicular chin. Yeah, the superficial clavicular chin, which is above the sternocleidomastoid mastoid muscle here. Okay, I'm gonna use the bats of my fingers, circular motion again, and move along. Do you have any pain? And I don't feel any masses. Again, the posterior clavicular chain lymph nodes. Do you have any pain? Okay. Now, I'm gonna ask you to move your head to assess for the deep clavicular chain nodes, lymph nodes. Move along them. Do you have any tenderness or pain? Okay, and the other side. Do you have any tenderness or pain? Now I'm gonna move to the occipital lymph nodes, which is behind the head. Do you have any pain? Okay, good. And then the supraclavicular lymph nodes, which is above the clavicle. Okay. So just keep it midline, and I'm gonna assess. Do you have any pain? So there shouldn't be any bumps, any hard masses, or anything like that. Okay, so now I'm done with the head, face, and neck examination. So we'll sanitize my hand, and we'll start the lungs. We'll start the lungs and thorax examination. Okay, so Abanob, I'm gonna have you sit down like this so I can visualize you. The first step is we're gonna start with inspection. So I'm gonna observe Abanob, observe his respiratory rate, respiratory depth, observe his effort of breathing, if he's having difficulty breathing, if he's using his accessory muscles to breathe. So everything looks good. Of course, the rate, the depth of breathing, is it like shallow breathing, is it rapid breathing? I'm gonna observe his rise and fall of his chest, the symmetry of the rise and fall. Make sure that both sides move together, so everything is good. So I ran out of gloves, but I sanitized my hand. I'm gonna use my hand to palpate his chest. Okay, so first I'm gonna be palpating for just randomly for any masses, any pain, any discomfort. Okay, if you have any masses, pain, discomfort, let me know. Okay, you have any pain, any masses? Okay, so everything that I'm gonna do in the interior chest is gonna be also done in the posterior chest. So right now we're doing everything on the interior chest first, and then when we're done with this side, we're gonna move to the posterior chest. So we're done with palpating. Now we're gonna do the tactile firmitus, which is the usage. So I'm gonna use the palms of my hands, and I'm gonna look for his intercostal muscle spaces. And I'm gonna place the palm of my hand on his intercostal muscle spaces. I'm gonna ask him to say something for me, and I'm gonna feel for the vibration. So I should feel equal vibration in both sides when I do the exam. If it's on a dull surface, like if it's on the rib, I shouldn't feel any vibration. But other than that, between the ribs, I should be able to feel it. Okay. Say 99 for me.
99, 99, 99, 99, 99, 99.
Okay, good. So there should be present, there should be resonant, and they should be symmetrical in both sides. Okay, so now I'm gonna feel for his thorax expansion, for his lungs expansion. Okay, so I'm gonna have both my thumbs on his skin. I'm gonna push it inside a little bit. I'm gonna ask you to sit upright a little and take a deep breath. Okay, release it. Take a deep breath. Release it. So as he breathes in and out, I should watch my thumbs go in and out with him symmetrically. So breathe again. So when he breathes in, my thumbs should go away from each other symmetrically, and when he breathes out, he should go in symmetrically as well. So now I'm gonna start. I'm done palpating, so I'm gonna start percussing his lungs. So I'm gonna percuss using my my non-dominant hand. The middle finger of my non-dominant hand should go between the ribs on the intercostal muscle, and I'm gonna use my can you move your head for me? I'm gonna use my dominant hand, the middle finger as well. I'm gonna tap twice, and I should feel a resonant sound. It should not be hyper resonant, and it should not be dull. It's gonna be dull if it's on a rib or if it's on a hard surface, like if the client has a problem. But normal client should be able to feel the vibration when I do this. So I'm gonna go symmetrically. I'm gonna do it. Okay, so. So the vibration should be felt in both sides of the lungs equally. It should be present again in between the intercostal space, like in the intercostal muscles. So yes, so it should be resonant. It should not be hyper resonant. Hyper resonancy, like if you feel like it's very vibrating, can mean that there is too much air in the lungs, like the lungs are too inflated, which can occur in COPD client, in a COPD patient, or an asthma, emphysema, all of that. Also, I shouldn't be I shouldn't be percussing, and I feel the dullness, especially because dullness can indicate that there is like a hard surface, when it happens, when this happens, it's usually like pleural effusion or something like that. So it's there is the consolidation in the lungs, which is not normal and should do further examination if we feel that. So this is the percussing. Now I'm gonna start auscultating. So to auscultate, I'm gonna use the diaphragm of my stethoscope. I'm gonna place it on your chest, and every time you feel my stethoscope, take a deep breath in and out, okay? Okay, good. So his breathing is normal. The breathing sound is normal. So what is normal? So when we auscultate this area over the trachea, you should get tracheal breath sounds. When you go a little bit down here, you should have tracheal viscular sounds, and the rest should be viscular sounds. This is the normal. So we should be checking, but he doesn't have his breathing is normal. He doesn't have any adventitious sounds, but some of the adventitious sounds, the abnormal sounds that we can hear when auscultating the lungs, can be wheezes, which is heard on exhalation when the client exhales, and it sounds like high-pitched musical sounds, and it's usually an indicator of inflammation going on, like what happens in asthma. There is also crackles, which can be an indicator of fluid in the lungs, which happen with pneumonia or heart failure. So it's like coarse sounds, harsh, a little bit harsh, when you hear like at the bases of the lungs, usually, or you can hear it all over the lungs, but usually present at the base. You can also, one of the adventitious sounds is friction rub, and it sounds like when two surfaces are rubbing against each other, and it's usually an indicator of pleural effusion as well, because the pleural membrane is rubbing against each other. So Abanob, I'm done with your anterior chest assessment. Now we're gonna do the same with the back of your chest or the posterior chest, okay? So yeah, I'm gonna have you to turn for me like this. So again, I'm gonna start by inspection. I'm inspecting his chest. I'm inspecting the rise and fall of his chest, making sure that it's symmetrical, making sure that there is no any using of accessory muscles. The breathing is normal. The rate is not rapid. The breathing is not shallow, or anything like that. Now everything looks good. Now I'm gonna go to again palpate his posterior chest. I'm gonna use my hands just randomly, just look for any pain, any discomfort, look for any masses, any tender areas, any abnormalities. And if he takes off his shirt, I should be also, inspecting the skin for any lesions or any scars or anything like that. But I'm not gonna do that because he prefers to keep his shirt on. So no pain, good. Now I'm gonna again do the tactile firmness on the back, on his back. Okay, so again I'm gonna use the palms of my hands use the palms of my hands and put it on the intercostal muscles. Again, avoid the ribs, avoid the scapula, because you're gonna hear dullness. It's not gonna work. Okay, so can you say 99 for me?
99, 99, 99, 99, 99, 99.
Okay, so I should feel his chest vibrating between the intercostal muscles when he talks, which should be resonant, and it shouldn't be uneven. It should be symmetric in both sides. Okay. Now I'm gonna check for your lung expansion or thorax expansion or chest expansion. Okay. I'm gonna place my thumbs on your lungs and ask you to breathe in and out. Okay. So can you move a little? So okay, take a deep breath. So as he breathes in, my thumbs should go away symmetrically. Can you breathe? Take a deep. Can you breathe out? So when he breathes out, I should see my thumbs go toward each other symmetrically as well. Okay. Okay. So now I'm done with palpation. Now I'm gonna again start percussing. So again, I'm gonna use my non-dominant hand. I'm gonna put the middle finger of my non-dominant hand over Abanobe's intercostal muscle. Again, I'm gonna avoid any ribs or any bones, okay? Because any of these gonna give me dullness, which is normal, but I'm checking for the vibration or the resonance when I tap my finger, okay? So. And then last check. Okay, so again when you percuss, you should feel resonant sound. It shouldn't be hyper resonant, because if it's hyper resonant, it can indicate hyperinflation of the lung. There's too much air inside the lungs, which happens in COPD, asthma, all of that. And it shouldn't be dull. If it's in between the ribs, it should be nice and resonant. If it's dull, there is a problem. It can be a consolidation problem. Something is wrong. And it should be symmetric in both sides. When you feel it, it should be symmetric. Okay, so now I'm done percussing. So now we're gonna hear the lungs. We're gonna auscultate. I'm gonna use my diaphragm. So I'm gonna start. I'm gonna ask Abanobe, every time I place my stethoscope on your chest, can you take a deep breath in and out for me? Okay. Okay. Breathe in, out, in, out, in, out, in, out, in, out. In, out, in, out, in, out. Okay, so his posterior chest breath sound should be vascular, most of them. I mean, like the majority of them, almost all of them should be vascular. So his breathing is normal, like I can hear his breathing. There is no wheezes, there is no crackles, there is no friction rib, there is nothing like that. Now I'm gonna do thyroid exam. So I'm gonna have Abanobe. I'm gonna take Abanobe's permission to be behind him, and I'm gonna use my hands to palpate his thyroid. So first let me look at the trachea, the thyroid. So the trachea, I have to make sure that the trachea is midline. So I can use my hands and put it here and move it here and there. Do you have any pain? Okay. And make sure that it's midline. I can visually see if there is any visible masses, goiter, anything like that. Okay, now I'm gonna use my hand. Can I stand behind you? So I'm gonna examine his thyroid gland from the posterior approach. Okay, so I'm gonna use 3 fingers of my hand. I'm gonna palpate the isthmus of the thyroid gland. So I'm gonna feel for it, and I'm gonna ask Kabanov to swallow for me. Can you swallow? So when he swallows, I can feel the thyroid, the isthmus of the thyroid gland goes up and then back down between my finger. And I'm gonna palpate for any masses. It should be symmetrical. Both sides should be equally present. There shouldn't be any tenderness, any pain, anything like that. Now I'm gonna use the interior approach. So I'm just gonna use my hand one at a time and feel for the thyroid lobes. Make sure that it's not there's no any masses, it's not enlarged. Do you have any pain? Okay. Do you have any pain? Okay. And there is no masses again. So to conclude, we went over head assessment, we did the face assessment, we did the mouth assessment, we did the lymph node assessment, and then we moved to the chest. We did the lungs assessment, the anterior and posterior chest, and then we did the thyroid gland assessment. And this is the end of my video. Thank you.